Hello, we are going to start your lecture today with a discussion regarding health and physical assessment for the nursing student. Health is more than just the absence of disease. As Nightingale stated, it is a state of well-being and use of every power the person possesses to the fullest extent. The definition of health assessment is a systematic method of collecting data about a client. With nursing, assessment is the first part of the nursing process, and over the next 10 weeks you're going to learn how to do a complete head to toe. Today we're going to look at the general techniques and equipment used in the health assessment for the student nurse. Let's look at the different components of a health assessment. There's the interview, often looks at the health history and can be a focused or more general interview. The physical assessment is the survey and examination of systems. Documentation is the legal record used to plan care and communicate the patient's status. And then also the interpretation of findings, which is looking at that data and determining, is it within normal limits, is it abnormal, and also what are you going to do about that. Data collection components include the health history, and that looks at primary sources, which consists of the patient, and secondary sources, which are family, other healthcare members, and the medical record. The focused interview can occur throughout the assessment, and it's focusing on getting the information of the visit or what you are trying to assess on the patient and to clarify that. And finally, the physical assessment, which is that inspection, palpation, and percussion, which we'll talk about a little bit later on. There are two other terms I would like to introduce to you during this slide, and that is objective data, which is the observed and measured by the professional nurse, and the subjective data, which is related to the symptoms. We cannot see it. Patient is going to report it to us, so that would be pain, nausea, dizzy, itchiness. This next slide I have for you is looking at some standard abbreviations. I want you to become familiar with them. You will be seeing them throughout your time as a nursing student and then also just as a professional nurse. Factors to consider during the health assessment: look at the developmental factors, which include the age, how old is this individual. You're also going to be observing their appearance. Do they appear disheveled? Are they well kept? Do their shoes fit? You want to observe with their intellect. Do they use words at the level of understanding that you would expect? I also want to add in at this point that with healthcare literacy, it is a term, healthcare literacy, that identifies a person's understanding of healthcare and healthcare related terms. Often as a healthcare provider, I learn new terms every day, and for patients that are unfamiliar with healthcare and healthcare environments, all the terminology and systems can be overwhelming. So we always try with healthcare literacy to put education, and when communicating to the patient, we want to put it at a level of a fifth grader. So very simplistic and to the point. Along with the developmental factor of intellect, you want to look at their cognitive development of the patient and their developmental levels. So with young children, often younger children have not reached a level of being able to think in abstract terms. So as a nurse, you want to put education, or when speaking to that younger patient, provide more concrete terms and don't try to oversimplify and say things such as, oh, this medicine will put you to sleep. A child might interpret that as death or dying. So being aware of that. And then finally, taking also into considerations for that health assessment, what is the developmental tasks or handicaps of this patient? Do they have a developmental disability? And if so, then you need to interact at that level of disability, not their current age level. Other factors to consider would be their psychologic and emotional factors. Anxiety, self-esteem, depression, and grieving all can prevent the patient from fully participating in the health assessment process. And then family factors would be illness history in the family, risk for inheriting diseases, perhaps a genetic predisposition such as we find with breast cancer, decision-making processes. They have a family history and group norm behaviors regarding who makes decisions. And so being aware of that, who is a decision maker or communication hub with the family. Other things to be aware of, cultural factors. This is very important, and your page in your book 69 to 71 really reviews multiple cultural group norms. So this slide is just going to be a generalization and an overview of it. Be aware of what the language is for the patient and know their preference. Do not assume that because they can speak, perhaps it's broken English, or they appear fluent enough that they don't need an interpreter. As we discuss medical terms, they may not feel familiar with the language enough to understand that. So it is important to ask if they need one or would like one. Expression. Different cultures express pain and emotions differently. And so being familiar that gestures are culturally defined and recognizing this. An example would be some Asian cultures will not express pain. They feel that it's important to have a stoic face and that if they need pain medication, then the healthcare provider will provide it for them. So you can't assess their pain merely based on their facial features or how you perceive they're being expressed. Emotional and physical well-being. How is that defined for their culture? What behaviors are associated with physical well-being? And health practices, specific healthcare practices regarding health and taking care of loved ones. Different healthcare practices that we're becoming more familiar with are cupping and coining, and knowing that that is a typical practice for them. With cupping and coining, marks are left on the body, and in previous circumstances it's been confused as abuse, when in reality it's just a practice for their culture. So respecting that and understanding. Environmental factors, internal and external. Internal factors would be the emotional state, emotional well-being, response to medication and treatment, what's their current therapy regime, and physiologic or anatomic alterations. External would be environmental, occupational exposures or living environments, such as an example would be a large city with lots of air pollution and that environment that is affecting the patient. There are 4 basic techniques of physical assessment. The first is inspection, which is a systematic observation. You're looking at color, shape, size, symmetry, body movements. Palpation, that's assessing through touch. You're palpating, you're touching. Percussion, tapping on body structures to produce specific tones that you're then listening for. And auscultation, listening to sounds produced by the body. Often you'll be doing that with a stethoscope. Inspection of the client is the first step. You're surveying their appearance. You're comparing right and left sides. You're looking for color, size, shape, and movement. There is some more medical terms I want you to be aware of that you have gone over in A&P. And again, as we go through this lab class, it is something that it is important. Palpation is the second part of the physical health assessment. And again, we remember that that is the process of assessing through touch. So characteristics you'll be looking for then would be size, shape, the location, mobility, position, vibrations, temperature, texture, moisture, tenderness, and edema. This is an example of light palpation. You start out with light palpation and you're monitoring surface characteristics, skin texture, pulse, and tender areas. Use your finger pads of your dominant hand and gently push 1 centimeter down, and you form small concentric circles and as you assess through the palpation process. This next picture is moderate palpation, and you're going to use a moderate amount of pressure and you'll compress 1 to 2 centimeters. And with this, you are assessing for size, shape, consistency, and mobility. Whenever doing palpation, if a patient identifies that they have tenderness or pain, do not push harder in that area. You assess that, you note that, and then you move forward. And also, your textbooks do identify deep palpation, and there, for nursing students, there is no deep palpation. That is not covered in this nursing program, and that is to be left for physicians and advanced practice nurse practitioners. The next method of assessment is percussion, and direct percussion is tapping the body with fingertips of the dominant hand. And for example, you see in this picture that the provider is tapping on the sinuses of this adult. Blunt percussion is when the provider has their palm of their non-dominant hand flat against the body surface and then strikes the back of the hand with their other dominant hand, and they're listening to the sounds from that percussion. And in this picture you see that they're using percussion over the kidneys. With indirect percussion, this gives you sounds that will give you clues to the underlying tissues. And an example of this would be over the lungs. And I'm going to post this YouTube video for you to watch this indirect percussion technique onto your blackboard so that you can see it. Different percussion sounds that you are going to hear are timpani, which is high-pitched, drum-like tone, resonance, which are loud, low-pitched, and you would hear those in the lungs, hyperresonance, loud, low tone, have longer duration than resonance, and an example of that would be air trapped in the lungs. Dullness is a high tone, and it's a soft, you'll hear that with solid organs, and flatness, another high tone, that is soft, and you'll hear that over muscles. Characteristics of percussion sounds includes intensity of amplitude, which is soft or loudness of the sound, pitch or frequency, which is the number of sounds per second. Duration is the length of time to produce the sound, and quality describes was it a clear sound or was it a more muffled sound. Different auscultation sounds. Again, intensity, soft or loud, pitch, high or low, duration, long or short, and then quality, muffled or clear. So that is just to help you from that previous slide to clarify. And that concludes the first part of our health assessment video. And the second part will be health assessment part 2. Thank you.